Commissioner Marecki. Commissioner Baidoon has requested an excuse. Commissioner Anderson. Commissioner Killeen. Chair Baker McCormick.
Here.
You have a quorum present.
Next item.
B, Chairwoman's remarks.
I have none. Next item.
C, approve of the September 12th, 2023 meeting minutes.
It's been moved and supported. All those in favor, vote please.
Change your name.
All right.
Motion carried.
Next item.
D, unfinished business. There is none listed.
Next item.
Item 1, under new business, forwarding the medical examiner's office turnaround time analysis from June 1st, 2023 through August 31st, 2023.
Is there someone from the medical examiner's office? Thank you. Hello.
Good, how are you?
Your name and record and for the record and can you, yeah,
Mike and all that.
thank you.
Just one touch.
Can you hear me now?
Yes.
Yep. I'm Charlie Rose, the Division Director for the Wayne County Medical Examiner's Office. So the report I submitted was the quarterly report from June 1st to August 31st. And it's during a 90-day period. 3,828 decedents were reported to the MEO office, and we accepted jurisdiction, for 825 of those cases. 524 of those cases were full autopsies, 273 were inspections, and 30 were limited autopsies. During that time, 356 of those cases were submitted for histology with the average turnaround time of 5.4 days. If you scroll down to the bottom where it's the total of the 825 decedents that were brought in through the 90-day period. 503 of those cases, the final cause of death was amended in around 13 days. Let's see, 195 of those cases took some time. Of course, those were pending cases, and the turnaround time was 33 days for those. Going to the second page where the cremation permits, 2,845 of those requests for cremations within the 92-day time period. And the turnaround time it says 0 days, of course, because it was approved within a couple of hours. And that will be all for this report.
Great. I'm glad to hear the reporting process is working out.
Yes.
Whatever changes you guys made, and it's working. So thank you. And Commissioner Anderson.
Thank you, Madam Chair. Just wondered, and I don't have that breakdown in front of me, but the number of firearm or deaths due to firearms.
I don't have that, but I can get it to you.
Okay.
Yeah, I don't have that in it. That's not in this report. I'm sorry.
Okay,
Yeah.
thank you.
Vice Chair Commissioner Killeen.
Thank you, Madam Chair. Oh, I guess this one would have worked too. Commissioner Anderson, would you like to see us a regular part of the report?
I think it'd be good.
Is that possible?
Yes.
Okay.
Great, thank you.
And then on the report itself, and I may have asked this in the past, we've gone through a lot. 10, 15 years with the medical examiner's office. And now we have Wayne State. And I do appreciate the reports, but I also want to have some idea about how this may be different from previous periods, like when I look at, and I had a lot of conversations with the Michigan Funeral Directors Association about the permits. So now we're turning them around just like that, which is a beautiful thing. Which is why my phone's not ringing. But then I see 30 days outstanding.
Yep. So 30 days, that's for you talking about for the cremation permits?
Yeah, for the 30 days for the funeral homes to pay.
Yes.
I'd like to know if that's changed, right? Or
It has changed substantially. We are still in the works of creating the online payment system so that they can pay online.
You're still doing that, okay?
Yeah, we are.
how much different is 30 days, 31 days, getting the bills paid on average from in the past?
It has gotten a lot better. I think the
Yeah.
billing system, we're sending out the bills in enough time for them to, submit their payment.
Okay.
Yep.
So I think we're appropriate
Mhm.
if we can have like, okay, this is the historical data, this is what we're doing now.
Okay.
As a way, because somewhere along the line, there's going to be a vote of the commission to re-up the contract.
Mhm.
And tracking data like this, how is it different now than in the past? Helps me a lot with that.
Okay. Yeah, that's great.
And I'll have kind of the same request on the next report too, Madam Chair, but
Okay,
that's my questions for now. So thank you.
thank you. Any other questions? All right, thank you.
Thank you.
Next item.
Oh, that's right. Sorry, ignore
Actually,
that.
yes, next item. We'll take, 1 and 2 together.
Yeah.
Item 2, forwarding a report by the jail division on the amount of medical insurance reimbursements collected comparing the results from fiscal year 2020, 2021 to fiscal year 2021 through 2022.
Good afternoon.
Good afternoon. Dr. Abdul Al Sayed, Director of Health, Human and Veteran Services and Health Officer for Wayne County.
Ernestine Williams, Assistant Finance Director for HSBS Finance.
All right, any questions about this or? No?
Yeah.
Yes. Oh,
Yeah, I
Vice Chair
get-
Commissioner
I
Colleen.
get that.
I'm sorry.
I know
heard-
you don't have, I know. It's
Go ahead.
to use or not use this thing. Thank you, Madam Chair. Kind of the similar request from last time. At one time, because this is based now on does everybody that is that we have in the jails, does everybody have Medicaid now?
So this is a policy question that is of interest. So once somebody leaves the jail and goes to a hospital, they can bill Medicaid.
Right.
But while they're incarcerated, right, we provide their healthcare services so long as they're not in the hospital. So the technical answer to your question is yes, but not when they're with us.
But I believe there was a time when if we had to send them to a hospital, we did not get reimbursement. Is that correct?
To my understanding, yes, and we're working quite a bit.
And those numbers got big.
Yeah.
And again, can you provide a little historical background here? Just in terms of it used to cost this much. And now this is what it's costing us.
So what I can tell you is that we are in a conversation with the Detroit Medical Center, who takes care of our incarcerated folks should they require hospitalization, regarding an arrearage in the low 8-figure value. Now, the question of what the overall arrearage is a question of it's an open bargaining, right? It's what is
Right.
What is billed, and then what they say should be billed versus what we say should be billed. What I can tell you though is making sure that any care provided for incarcerated folks is Medicaid eligible and billed is something that we've put a lot of effort into. I will say that this report isn't simply about the jail division. It's really about our ability to bill against operating insurance across several units. Whether you're talking about public health, you're talking about FQHC, or you're talking about the jail unit. And so one focus for us in the coming fiscal year has been billing across our department. And so in the fiscal year 24 budget that Commission approved, we've got added space for more billing supports, and we intend to put those folks to good use to be able to recoup a lot more against the value of clinical care that we're providing. And so, that offers an ability to make our department and the county more sustainable and to recoup mostly federal dollars that could come in to support some of our services.
All right. Thank you. Let me make sure I understand this. This report this doesn't deal with when we send somebody to a hospital. this is all kind of internal to Wayne County and our
Yes.
contractor. And I understand your situation with the billing. That's not this. But just to have some sort of a handle on, because these numbers used to be really big. Really big. So again, just kind of see how things have changed. But I'm only looking at one part of it here. And I don't know. You're talking arrearage. I don't know if the day-to-day stuff is going okay when somebody goes out.
Part of the challenge, of course, is that we transitioned jail health providers, and
Yes.
our current jail health contractor has been more fastidious about billing. And this is a point of constant engagement just to make sure that we're billing against all the services that are provided and those aren't arreared back to the county.
And given there's discussions going on, maybe sharing numbers at this point is not a real thing. Is that your opinion of it too? Because I would like to get some sense from the department, because, and you alluded to an 8-figure, that's a lot of cash. And so to have some idea how this is changing, or if we're getting more costs recouped, somehow I would like to get some sort of more of a sense of that, as opposed to just internally. And I'm sure these numbers have gotten better too, as we're able to internally track stuff better and bill it to the appropriate place within the county. Then that's probably gotten a lot better as well. For folks that have to leave the jail, I don't know how you can share that with us or give us some sort of an idea about what's going on and what the dollars involved are.
So what I'll tell you is I appreciate the question you're asking. The challenges that the question you're asking for, or the number you're asking for, is a quotient and requires a numerator and a denominator.
Correct.
I can tell you the numerator, the denominator is a little bit harder to assess. So what I can tell you is we have been working with NAFCARE to bill against all possible billable care that's provided in a hospital, right? And to make sure that gets billed, it gets billed on time. And so we're no longer accruing arrearages. The question of outstanding arrearages, that's something that's still under negotiation, and certainly any settlement that's reached would have to be passed and approved by this body. So it would certainly come to you. But I appreciate the nature of the question is how efficient are you at billing the services that are required by incarcerated people? I'll also tell you, though, that the nature of the numerator has also declined in large part because our current contractor can handle a lot more in-house. And so the amount of care that's required to be shipped out to a hospital has been lower as well. And that's generally good news for incarcerated people in the jail, because it means they're getting care right where they are.
So to get reimbursement from hospitals, and of course the DMC is the closest, so we go there. If we have that kind of arrearage, how do we handle that in the books? Where is that
So
8-figure amount in our books?
yeah, I that is a question for the legal folks to answer. And what I will tell you is, as we work toward closing that out, right, where that will come from will certainly have to be approved by this body.
But it has to come from somewhere right now.
The high probability is that we have an indigent health fund, and that can be leveraged to support. Certainly, for us, the question of what that value is still something that's up for debate between us and DMC.
Okay. For now. Okay, thank you. Thank you, Madam Chair, for now.
Thank you. Is there a motion to receive and file item 1 and 2?
Yeah, I tried. Now I gotta sign back in. There we go.
Right.
Beat you to it, dude.
Been moved and supported. Can vote. All right. Sherelle, I went down, so you could just vote for me. Yes, okay. All right, motion pass. Thank you. Next item.
Item 3, requesting commission approval of Amendment 4 to a 3-year contract with 2 one-year options to renew with house arrest services, adding funds to accommodate the increase in the number of juveniles being placed on tether.
Great. Good afternoon, Madam Chair. Melissa Fernandez, Director of Juvenile Youth Services. And what you have is our Fourth Amendment requesting additional funding for a contract we have for tether services for our juveniles. We've seen a significant increase in the use of tether. When we started the contract in 2019, we had a total of 436 kids on tether. This fiscal year through August 31st, we've served 1,442 youth on tether.
Yeah. That's a major increase. Yeah. Commissioner Anderson.
Thank you. Do we have any idea how many of those that are on tether are committing crimes? Do we have some way, do you have some stats on that?
We do, and we can provide that information to this
Okay.
body.
And whether, is there a constant assessment of whether or not greater restrictions need to be placed on those, the decision placing those on tethers? I just wonder if we're contributing to the problem on by releasing too many kids that should not be released on tethers. That's all. Thank you.
And to that point, so when they're on tether, they're restricted to go from, I guess, home to school only, or
That is
what does that
correct.
look like?
It depends on what those parameters are that are placed by the court and the care management organization that is monitoring them.
Okay. All right, Vice Chair Commissioner Colleen.
Thank you, Madam Chair. I had very similar kind of comments, so if you could provide that.
Absolutely.
So 3 to 4 times as many as 3-4 years ago. So what is the total number? Where are we at with the total numbers that we're still holding in the juvenile detention facility?
Correct. So today, our census is 108 in our detention center, down from 160 a month ago. We currently have 39 kids who are in the detention center waiting for level 2 placement, which is secure placement.
So there's 109 there.
Correct.
What is technically our capacity?
We are licensed for 160, 180 at Dickerson,
80, okay.
160 at the new facility, 180.
So has staffing issues been ameliorated a bit?
It really has, and with the decrease in census, we're able to maintain the ratio better than we have.
And the state of Michigan's happy with that?
We continue to work with this.
There's really no yes or no answer to that. I'm sorry for asking it. So yeah, but I'm interested in that too, that so they're monitored by the CMOs.
That's correct.
So we have to get data from the CMOs.
We have that data, but we can certainly.
Yeah,
provide
yeah.
that.
No, I think that's an important one.
Okay.
Because these things, pop out into the public from time to time.
Absolutely.
And then all sorts of questions about, well, you're gonna get questions no matter what in the
Right.
in the correction system. So yeah, if you could provide that data, and I'm glad to hear about the numbers.
Yes,
Yeah.
we are too.
So did that
Thank you.
address the issue of the adjudicated youth?
The decrease in the population.
Right.
So we have had an increase in adjudicated youth moving into placement. We
Right.
are preparing, the state of Michigan is preparing to open a 20-bed facility in Macomb County called Rite of Passage that will specifically take Wayne County youth. So they will open a 20-bed facility for Wayne County youth only. I've been meeting with the CMOs, and by Friday, we'll have that list of 20 who are prepared to leave from the detention center. So
Okay.
that will assist us as well.
So how many would that be that would be left behind, I guess?
So we have 39 currently waiting for placement, and we'd move 20.
Okay. All right, great. The numbers are getting better. That's where we want to get. So, okay, great. Any other questions? No other questions. All right, thank you.
Thank
Next
you.
item. Or is there a next item? Yes, 4 on the agenda.
Moving to item 4 on the addenda. Requesting commission approval of a one-year local health department grant agreement with the Michigan Department of Environment, Great Lakes and Energy, Drinking Water and Environmental Health Division for county water quality testing and management.
Good afternoon.
Good afternoon, Natalie Dean Wood, Division Director for Public Health. We're just asking for you all to approve the one-year local health department agreement between us and Eagle for our water programs.
All right. Vice Chair Commissioner Khalid.
Thank you, Madam Chair. We've been doing this for a long time with the state. I think this is swimming pools
Pools is a part of it.
and what's left of septic fields out there
That is
out in
true.
western Wayne County.
Yeah.
There's a few beaches involved in Belleville Lake or something. I forget. We've got a few beaches involved. Is there any change in what this money is going for? Any change in do this, do this, do this with the money from the state of Michigan?
No, there's been no change.
And how does this amount compare with previous years?
Actually, this year we have an increase of $4,000.
Ooh, all right, let's test. Thank you. Thank you, Madam Chair.
All right, and drinking water, is that overall in Wayne County, the testing, the
Yes.
quality?
Yes.
Or is it certain areas in Wayne County?
This is for the entire county of Wayne,
Okay,
Out County.
and how is that done? I mean, do you just test? I mean, one area, I'm not sure how the whole water system is being tested. That's what I'm asking.
So actually residents as well as the health department have an opportunity to get these testing kits and they can test their own water, or we also go out and geographically test in different areas.
Okay, but is that testing done haphazardly, or is it strategically, or if you get complaints in certain areas?
If there are complaints that rise, but it's also strategically on a calendar. So
Oh.
it's like a rolling
Rolling,
type
okay.
of testing.
Yeah, okay, all right. Thank you. That was the question I had. Any other questions?
Yeah, Madam Chair.
Oh, Vice Chair Commissioner Khalid.
That was news to me that there's testing kits available for people to do it in their own homes.
Mhm.
Uh, please provide something on that. I don't know
Okay.
how many Wayne County residents know
Okay.
that that is a possibility for them.
That they can get testing kits.
I think, you know, the average person, of course, would be interested, but I think there's probably homes out there where there's people that have certain conditions in the home that it might be good for them to know. So I would like to let residents of Wayne County know, hey, this is available to you to be able to do this in case you're concerned. And now with all the basement flooding,
Right.
right? And I don't know about you guys, but I see in my Facebook feed all the time, hey, anybody else have brown
Brown
water
water.
over here on XYZ Avenue, right? I'm seeing that. And when those kinds of things happen, people might want to know, because browner water isn't always a public health risk, but the heightened concerns that are out there for what's coming into my house in terms of clean water, that's been heightened in the last few years. So if you could share something with us, and
Okay.
that would go to all commissioners, I would think.
Yes.
I would really appreciate that. Thank you. Thank you,
And-
Madam Chair.
Yeah, and just, do you have kits that you could bring in to the commission at our next meeting, maybe?
Also work on that.
Yeah, let's
Okay,
test the
yeah.
water in this building.
Right, right. Or just get one to take home with us, you know? So, okay,
Are we citizens too?
yes,
Oh,
we
okay.
are.
I'm-
Exactly.
I'm just saying, yeah.
All right, thank you. Next item then.
Item 5, requesting commission approval of Amendment 1 to a 4-year memorandum of understanding with the Wayne County Prosecutor's Office to continue the Right Track Diversion Program at the Third Circuit Court Juvenile Division.
Good afternoon, Madam Chair. Melissa Fernandez, Director of Juvenile and Youth Services. And we are requesting approval for our MOU with the Prosecutor's Office to continue our Right Track programming. We'll also be adding funding to that MOU as well.
All right.
And briefly, in 2022, there were 390 cases referred to diversion. 334 were accepted by the prosecutor's office.
All right, and the other, what happens with that, the other, group that does not move to diversion? What do you
Or
do?
they
with
move
those?
to formal prosecution. So
Okay.
when you are accepted for diversion, you complete the programming. If you do not complete the programming, you move forward with formal prosecution as well. So the young people who are not accepted by the prosecutor move forward with formal prosecution.
And they end up in the detention?
Correct,
Okay,
correct.
okay. Vice Chair Commissioner Khalil.
Thank you, Madam Chair.
Mhm.
So the prosecutor makes a decision based on what they have in front of them, which direction they want to go. To get in this program, does it take a juvenile judge to say, yeah, we'll allow you to do that?
Yes,
So that there is an order of the court that does that.
that is correct.
So it's not just the prosecutor that's looked at it, it's also the courts have looked at it to say, yeah, we think this is a good candidate.
Correct.
Okay. Thank you. Thank you,
welcome.
Madam Chair.
Thank you. Any other questions? All right, thank you. Do I have a motion for approval of items 3 through 5? It's been moved and supported. All those in favor? Motion pass. Next item.
F, such other matters as may be properly submitted before the committee.
There are no